While not the first policy primer held in this theater, this is a first of its kind event for TPPF. We are welcoming perspectives across the ideological spectrum. We also have a state practitioner, and we also have a representative from a federal office here to really give us a more informed discussion of mental health policy here in Texas and in the United States generally. Recent high-profile tragic events have thrust mental health into the limelight, and while these events might not have been wholly avoidable, proper safeguards were lacking. Procedural safeguards failed. The lapses that help contribute to the loss of human capital are surely a dark mark on Texas's correctional history. Removing that mark is important. Individuals with serious mental illness could be a friend, they could be a neighbor, they could be a family member. So critical are the nuances surrounding this issue that when and she begged me not to tell this story, but during Ms. Murphy's hiring process, I asked her, what is the difference between providing facility-based or any sort of incarceration-based mental health service delivery? How's that any different from an actual prescriptive right to mental health care? Why should we provide services to those who run afoul of the law and versus those who are actually law-abiding? No, I did not actually. That was more of a rhetorical question. I did not expect as good of an answer as I received, but I still remember what she said. She said there were 3 points of why this is important. There's public safety, there's constitutionality, and there's cost. First and foremost, the public safety argument. A decompensating individual is certainly not per se criminal. However, estimates as high as 20%, that low to mid-level offenders held in county jails are there for some action or activity that is acutely related to a mental health disorder. If untreated, this individual will likely be returned to the community in the same mental state that they arrived in. This stands to create an entire second group of victims. Secondly, the constitutionality. The constitutionality argument goes as few governments in history have actually had the unilateral authority to compel mental health treatment upon otherwise law-abiding citizens. What we kindly have, since the treatment here comes at the mandate of a state sanction, criminally involved persons with mental illness are sentenced to treatment, but are only done so after full observation of the due process of law. And then finally, we have the cost issue. We have cost. There are multiple vectors through which a person with mental illness enters the criminal justice system and might also burden the taxpayer in terms of what has to be paid. There are incredible costs associated with incarceration that, while wholly necessary in some cases, can be avoided through alternative sanctions in others. The distal costs of chronic mental illness are also passed on to taxpayers through long-term disability. So these are just some of the nuanced issues that we are here to actually discuss today. We're talking about the intersection of 2 very critical items in public policy, of criminal justice and healthcare. What we should understand is that we are not dealing with any sort of muting criminal sanction or any sort of ameliorating punishment for criminal culpability. Quite the opposite. What we're talking about here is sound public policy. So, without further ado, let's begin the discussion. Our first speaker today is Kate Murphy. I'll read you in. So Kate Murphy is our mental health policy fellow here. She was inducted into the National Order of Barristers and received an award for her accomplishments in constitutional and property law. Before joining the foundation, she worked as an attorney in Houston. She graduated magna cum laude from Austin College, and she earned her law degree from Texas Tech University School of Law. Ladies and gentlemen, Kate Murphy.
Well, as Derek said, I am Kate Murphy, and I'm the Mental Health Policy Fellow here with the Center for Healthcare Policy at the Texas Public Policy Foundation. What I'm going to talk to you about today is really kind of an overview of one of the most significant pieces of mental health legislation that happened this past legislative session, and that came out of the Sunset Review process. And I'm going to talk about how some of the changes that came out of the Sunset Review process are going to affect the criminal justice system. One of the biggest problems that Texas faces in terms of the intersection of mental illness and the criminal justice system is a lack of coordination and a lack of communication across the board. So that's a lack of coordination and communication from state government to local government. It's a lack of coordination across systems, both the mental health system and the criminal justice system. And one of the things that happened this session, as I said, was the Sunset Advisory Commission reviewed all of the health and human service agencies in Texas. So that's the Health and Human Services Commission, the Department of Aging and Disability Service, the Department of Assistive Rehabilitative Services, the Department of Family Protective Services, and finally, the Department of State Health Services, which administers most of the state-level mental health services. In reviewing the Department of State Health Services, there were two pretty critical pieces of mental health that the state was really not doing its job. And one of those was the state mental health hospital system. The other was the community behavioral health system. And what we were seeing, particularly in the state mental health hospital system, was a capacity crisis. The state mental health hospitals were all at or over capacity for a significant part of the year. During 2013, the Sunset Commission found that for about a third of the year, state mental health hospitals were entirely inaccessible by anyone, whether it was special need, forensic patients, across the board, they were fully at capacity and no one could reach the services provided in the state mental health hospitals. Part of this was driven by the forensic population. For the first time in Texas history, the forensic commitments, which include people who were found guilty, not guilty by reason of insanity, and people who were incompetent to stand trial, were outnumbering the civil commitments. So people who were there voluntarily for service or people who were there for another civil commitment out of a public safety concern or a concern for their own safety. Part of this issue stems from the fact that the criminal justice system and the courts are largely overwhelmed by cases involving people with mental illness. So part of that has to do with the fact that we're not coordinating, as I said, across systems of care, across the criminal justice system and the public mental health system, and across state and local government. This reminds me a lot of the issues that were facing the criminal justice system 5 years ago, where our state prisons and state jails were at capacity, and Texas was expected to build, I think, 5 more prisons to alleviate the capacity. So there's been a lot of talk about adding additional state hospital beds to fix the problem, where I think the focus really needs to be on being wiser about how we use our resources and using the resources at our disposal in a more intelligent and more efficient way before we start talking about whether we need to add capacity. We need to be looking into community alternatives that are often better for treatment, that are often, that are almost always more cost effective, before we start simply adding capacity to our state mental health hospital system. So what this really comes down to is the Department of State Health Services was not doing its job to protect the public health and provide care through state mental health hospitals and community behavioral health programs. There's also a lot of issues with having funding silos and services that are just scattered throughout the state system. The left hand doesn't know what the right hand is doing, so to speak. So there was a consolidation back in 2003 of the state institutions that was supposed to help streamline some of these processes and really bring about integrated care. And what we're seeing is that 15 years, or it's 1999, excuse me, 15 years after this initial process was started, the state mental health system is largely unchanged. And we're still operating in these pre-consolidation silos. And we have kind of a nesting dolls of agencies throughout. When you look at mental health funding in particular, It is scattered across 18 different state agencies and 5 articles of spending. So it's easy to see how there might be a lot of duplication of some services and how there might also be a lot of gaps in services that are difficult to identify because funding for different mental health programs is happening in little boxes all over the place rather than in a coordinated system that's really aimed at specific outcomes for people with mental illness and outcomes that are what we're hoping to see, like reduced jail sentences, reduced jail time for people with mental illness, greater employment, better housing situations, things of this nature. Let's see. Part of the problem exacerbating this issue is that the state mental health hospitals they're very expensive. First of all, they cost between $560 and $995 per bed per day. So we're talking about a great expense, an expense that's much greater than the cost of incarceration, and it's largely being filled up by people who are going through the criminal justice system. So some of the things that we can look at there are outpatient competency restoration, which there were some bills surrounding this session. There's been a pilot program going on in Texas surrounding outpatient competency restoration that's been very successful. We also need to be looking at different ways to divert people with mental illness from the criminal justice system when possible. And what I think we're seeing occur regularly in Texas is the criminal justice system saying, hey, public mental health system, we'd like to work with you guys. We've got problems and we'd like help. And because the public mental health system is really so disorganized, so lacking in integration, and really not doing the job that it's supposed to be doing, it's kind of like, I mean, yeah, we'll help a little, but do what you need to do and we'll see what we can fit in. So there's sort of this disconnect where the public mental health system is not incentivized to help with the issues that we're seeing in the criminal justice system. And I think what we need to be looking at to improve that is how do we incentivize the local mental health authorities, what's going on in communities to interact with the criminal justice system and really work to bridge the gap between the two. And that's where I think the state government needs to take a more active role in overseeing what's going on and making sure there's transparency in what's happening in coordination between local communities, because the state comes up with all of these policies. They say, here's what you're going to do, here's some money for it, have fun. And what they need to be making sure happens is that's actually being implemented, that they're rewarding good behavior on the part of local providers and really bringing together a system that rewards positive outcomes and doesn't just throw money into a system that isn't working.
Thank you, Kate. Our next speaker is Catherine Ligon. Catherine is the mental health policy analyst at the Center for Public Policy Priorities. Catherine interned with the Legislative Study Group during the 2009 legislature. And you're going to have to help me with this one, Catherine. Spent nearly 2 years at Nuestras Pequeñas? Pequeñas Rosas. Home for abandoned and abused girls in San Pedro Sula, Honduras. Prior to joining, she was a Hogg Foundation Mental Health Policy Fellow, and she holds a BA in Psychology and a Master in Social Work from the University of Houston. Ladies and gentlemen, Catherine Ligon.
Thank you for having me here today. I really appreciate the opportunity to talk with you about this very important intersection, mental health and criminal justice. Just to give you a little bit of a background of the Center for Public Policy Priorities is an independent public policy organization that uses data and analysis to advocate for solutions that enable all Texans of all backgrounds to reach the full potential. We envision a Texas in which everyone is healthy, well-educated, and financially secure. At the center, like Derek indicated, I concentrate on mental health policy. That's policy and the budget process as well. Primarily, I focus on ensuring that all Texans have access to mental health benefits, whether that's through the public mental health system, through your private insurance, and also ensuring that there's a robust workforce, a mental health workforce system to serve the whole entire population. And so that's my primary focus. I would like to kind of take a couple of seconds to really talk about recovery and what recovery is and mental health recovery is possible. I think that's really important in this context of talking about individuals with a lived experience of mental illness, is to really indicate and share that there is a possibility of recovery. And Veronica, who's going to speak next, is really going to be able to highlight that much more eloquently than I am. But just to put it out there, mental health recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Recovery emerges from hope, and hope is internalized and it's fostered through relationships with your family, your allies, peers, and others. It's the catalyst. Hope is the catalyst for the recovery process. It's achievable for many individuals. We just need to really create pathways, several pathways in which people can access treatment and services so that recovery is possible. And like what you heard Kate stating is that over the last 10, 15 years is that we've really heard from local sheriffs and hospital administrators that there have been an influx of individuals with a lived experience of mental illness entering in the jail system and also emergency rooms, with high utilization in those two departments. And it turns out is that the sheriffs and so forth have been the mental health advocates, some of their largest voices and champions into ensuring that people have access to health care in the community with their in the least restrictive setting. Incarcerating rather than treating individuals with a mental illness comes at a large fiscal cost and human cost as well. Within the last 2 years, of the 3 years that I've been at the center, I've taken a deep dive into reentry services for individuals with a lived experience of mental illness, primarily focusing on the Texas correctional system, whether that's the state correctional systems or the county jails. And really my effort has been with the lens to focus on connecting individuals from those correctional facilities to the community mental health system, trying to maintain that continuity of care. Kate really talked a lot about diversion before individuals get involved with the criminal justice system, or even while they've just first encountered that criminal justice system. Unfortunately, there's times in which, due to the nature of the offense, some individuals are going to be incarcerated, and we still need to have a holistic, robust system to ensure that people are able to connect from those facilities into the community. Barriers to recovery to successful reentry disrupt the continuity of care and thus the recovery process. I think one of the things that we really looked at within this kind of deep analysis is looking at the benefits of peer support services. Peer support services is a cost-effective, evidence-based practice in which an individual with a lived experience of mental illness has gone through the recovery process, provides support, guidance, and mentorship to another individual with a lived experience of mental illness, and that's going through that initial process of recovery or midway through the process. Peer supports provide a large spectrum of services, ranging from assisting, connecting individuals to the community services, integrating into more moving it into integration into homes and into their workforce and things like that. It's really sharing that lived experience is really what's the primary connection there. what we look, so and as a result of this deep dive, we put together a paper, and it's longer than it should have been, to tell you the truth. But what we concluded at the end is that there's an opportunity to use peer support services as a way to help individuals who are coming out of the county jails, and to help them as they're transitioning out of the county jails into the community mental health system, using that lived experience of a mental illness, also perhaps a lived experience of incarceration, helping that individual transfer from one point to another, so that they maintain that continuity of care. They're connecting with their treatment providers, they're integrating into the community with the hope of recovery, and as a result, reducing recidivism. And we've seen this work in other states like Pennsylvania, where they have very similar programs just like this, and it's reduced their recidivism rate in the counties that they've been working in. So we were fortunate enough to be able to explore this idea. We took it to the legislature, and there's a rider in the budget that allows for a pilot program that DSHS is creating at this point in time, to look at a community that has an existing peer support program and can work with the jails to promote this idea of using peers to help with reentry. One thing Kate and I worked on during the legislature was a bill, it's the Senate Bill 1507, which ended up just being kind of a small bill, that it became like the big bill for mental health sunset-related issues. But the core in which we were working together on was it creates a forensic director position within the Department of State Health Services. And what we've heard today is that there's been a lot of the jails have been the de facto mental health providers. And there are a lot of individuals who are in the county jails that are not competent to stand trial, or that have been gone through their adjudication process, and then they've been determined to be not guilty by reason of insanity. And so thus that we have created a forensic mental health system in which individuals are with lived experience of mental illness are going to the state mental health hospitals and receiving services, either going back to the jail or remaining in the hospital there. And so what this forensic director position really has the opportunity to do is to create a coordination and of the services from an individual who is in a statewide transitioning from the hospital to the county jail and so forth. We've seen this work in Maryland, Wisconsin, and Virginia, where we have such a geographic vast state. There are sheriffs that are coming from the Rio Grande Valley that are having a hard time getting hospital placement for an individual. And in San Antonio, they go to San Antonio, the bed's not available. They move on to Austin, there's not a bed available there. And then they're spending time traveling around with an individual who is needing treatment and services, instead of spending that law enforcement officers instead of spending time in their community, serving their community. So this position really creates an opportunity for coordination and a best way to look at oversight between the two systems of mental health and criminal justice. Again, thank you for your time. I appreciate the opportunity. Thank you.
Thank you, Catherine. Our next speaker is Veronica Alfala. Veronica is a peer support specialist on the forensic unit at the Austin State Hospital. Veronica has experienced abuse at an early age, triggering a bout of addiction. Her addiction led her straight to prison many times over. Veronica has been drug-free for 17 years and holds a BA in psychology from Texas State University. Ladies and gentlemen, Veronica Alfala.
Hi, everybody. I'm Veronica, and I thank you so much for having me here. I'm incredibly nervous. This is a very vulnerable position to put myself in, sharing my story. What I do at the hospital basically is we share our experiences and connect with people. You know, like the people I work with have been isolated from society, you know? And some of the things that I share with them are what I'm going to share with you right now. So I'm going to just kind of start from the beginning. I was, from a very early age, I can't even remember a time when it wasn't happening. I was sexually abused by my dad for 18 years, and it was a very difficult time. I couldn't use my voice. I couldn't really ask for help. You know, like there was nobody who could really hear me. You know, so and I would pretty much was anything anybody wanted me to be was kind of that thing. And Carrie, oh God, I'm so sorry, I'm nervous. After that happened, after that 18 years, I got out of the house and I started using heroin at a really early age. Actually, at the age of 13, I started getting high on like marijuana or whatever, and then that went to heroin, which led me down a really dark path, you know, led me into a lot of drug dens and stealing and jail. I ended up in jail many times. I have 3 felonies on my record. Excuse me, I'm sorry. I have 3 felonies on my record, and I'm kind of getting really stuck here, I'm sorry. And these are hard things to share with people that you feel sometimes don't understand these things, you know? But I am here to give that human perspective. It's very important to me. You know, like sitting in jail, you know, you kind of think like, how is my life going to turn out after this? What am I going to do? How am I going to be able to make a life? You know, like after all this stuff, you know, like with the abuse, with the drugs, and now with the jail, you know, like who's going to hire me, you know? And I want to say one thing. When I started getting into trouble with the jail system, I had asked for help. And I made a plea to the judge, like, you know, hey, look, I've had some really, you know, hard situations in my life, and could you look at that? And that was never something that was even looked at. And I really wish that that was something that could have been considered in the sentencing and how they kind of carried on forward with my life. I ended up in a lot of treatment facilities, drug rehabs, and actually there is where I learned a lot about myself. I learned about my voice. I learned about who I am, what I want, you know, and it took a very long time. And all of that really happened when I was in New York. So by the time I came back to Texas, I ended up, you know, using drugs a little bit longer. I had a son. He's 20 years old now, and he was actually a big part of me wanting to change my life, you know. He was just a blessing to me because I don't think without him I could have changed. Yeah, thank you. I appreciate it. It's really tough. I'm sorry. Where do I go from here? Yeah, so having him was like a blessing, you know. So kind of having him, I started to think like, what do I want to do with my life? Because at that point, I already now had a little bit of clean time. I was going through a huge, deep depression where I was at home all the time, sleeping all the time. I didn't know what he was doing. You know, he was just kind of like this little 2-year-old kid running around, and I'm sleeping, you know, like wasting my life and his life. But all the while still thinking, what do I want to do? Like, how am I going to change this? And I don't know, like that thought right there just kind of really started to grow, you know? And I said, well, you know, I really want to go to school, you know? And I called up this lady from ACC, and I just kind of like told her everything that I'd been through, and she's like, come down. You know, I went down, I registered, and it took me like 10 years to get my bachelor's, but I finally got it. I'm currently now working at Austin State Hospital on the forensic unit, where I get to, meet some incredible people going through an incredibly hard time. Yeah, I don't really know what else. Okay, but for like the future for me right now, I'm going to be going back to school for my master's in social work. And there's like some barriers there right now. Like I have to write the Texas Licensing Board and kind of asking them if I can get a license with my past. And hopefully I'll get a yes. So pray for me, and that's it.
Thank you very much, Veronica, for sharing your story. Our final speaker is Stephen Townsend, counsel to U.S. Senator John Cornyn. Stephen advises the senator on issues of criminal justice, border security, and immigration. He has served as the senator's lead drafter and negotiator for numerous pieces of legislation, including, relative to today's discussion, the Mental Health and Safe Communities Act, the Justice for Victims of Trafficking Act, the Corrections Act, and the Sexual Assault Forensic Evidence Reporting Act. Stephen is a graduate of the University of Texas School of Law and also of East Carolina University. Ladies and gentlemen, Stephen Townsend.
So just wanted to start out by thanking y'all for having me, giving me an excuse to jailbreak out of DC for at least an afternoon here, or at least a morning and afternoon. I also wanted to note how appropriate it was that on a Texas Public Policy Foundation panel, y'all put the federal speaker last. It's striking a huge blow for federalism. Maybe that should be a rule. I'll defer to y'all on that. So anyway, I wanted to take a few minutes to discuss with you, as Derek noted, Senator Cornyn, since we're talking about prescriptions here today, Senator Cornyn's diagnosis of the problem. See what I did there? Diagnosis of the problem, constraints on the federal role in this issue, and then Senator Cornyn's, I guess, his prescription here, which would be the Mental Health and Safe Communities Act, which the senator introduced in early August this year. So I'll take you through just a little bit of background on myself first. So as Derek said, I am Senator Cornyn's senior counsel on the Senate Judiciary Committee, handling criminal justice, immigration, and border security. Prior to my time in D.C., I had the privilege of working in the Texas State House of Representatives. So it gives me a good perspective on what's appropriate at the state level, what's appropriate at the federal level, and how we balance those competing interests and roles. So Senator Cornyn thinks of this issue, the mental health and criminal justice issue, or I guess just the mental health issue generally, in terms of a pendulum. In the 60s and 70s, 50s, 60s, and 70s in the United States, we had a mental health system which focused on institutionalization first, treatment second. That was the goal, that was the policy. Then in the 70s, 80s through today, the system changed based on civil rights lawsuits, policy choices in state governments, and for a number of different reasons, to the situation we see today, which is really just a transition back to full-on institutionalization. We took people out of state mental health hospitals and put them back on the streets. And lo and behold, now the mentally ill individuals are coming back into institutionalization, except this time they're not in state mental health hospitals. They are in incarceration in jails and prisons. So the system we have right now, the national system, is inefficient, it's ineffective, it's inhumane, and it's extremely expensive. It's sort of all the things, all the boxes you look to check when you're saying something is ripe for policy change. The mental health system in this country has gotten to that stage. So what the senator is focused on is, so he sees it as the pendulum swung from institutionalization first to no institutionalization. But the linchpin that's missing in all of this is a treatment first objective for the system. So the senator believes that the way you calibrate this system to work better is swinging that pendulum to the middle there, which is treatment first, and with treatment, we reduce the need for institutionalization based on advances in science and technology. We have the ability to change the arc of a mentally ill person's life. That so often we see these tragic cases of violence across the country where an individual starts out committing minor offenses, drug possession offenses, domestic violence offenses, loitering offenses, and then slowly through our inefficient and ineffective system, we actually make the person worse. We put them in jail. A mentally ill person who is incarcerated without treatment is almost always going to come out worse off than they were when they went in. Worse off and potentially more violent. So I think it's incumbent on us to work to break that cycle and to do everything we can to break that cycle. So what's the federal role in all of this? Right now, y'all should be getting really nervous. You've got a federal government employee coming up here telling you everything, all the changes we're going to make. So you should be nervous. I don't fault you for that. So what is the federal role then? Well, I think there's 4 important components to this. Number one, the federal government operates the largest criminal justice system in the United States, the federal prison system, and the federal law enforcement agencies. So I think first and foremost, the federal government's responsibility is to do their job right. Second, the federal government oversees what we call the National Instant Criminal Background Check System, or NICS. And through NICS, we share mental health records across state lines. And those records are used to run background checks on prospective firearms purchasers and exclude certain dangerously mentally ill people from obtaining firearms. So the federal government has a role in interstate data sharing and records coordination, things like that. Third, federal government, one thing we do well in some cases is work to help implement interstate best practices. At a state's election, helping a state who's interested in tackling an issue do some of the learning from other states that have tried innovative policy initiatives on certain issues. And in the mental health context, we see a lot of, we met with some officials down in Bexar County, which has done just great work. Sheriff Pamerlo down there has just done excellent work in sort of doing a sequential intercept model to try to figure out all the different points at which we can treat mental illness in the system. But we talked to them, and I think the telling thing they said was, there's a lot of state and local systems that do 1 or 2 things right. They do 1 or 2 things well. They either get the reentry correct, or they get the treatment in prison correct, or they get the diversion courts correct. They get 1 or 2 things right. But getting all the policy programs in place to address the problem all at the same time, all working in coordination, is difficult. We think the federal government has a role in surveying what's going on, what's working well in the state governments, and helping state governments that want help to implement some of the best practices we see across the country. And then finally, the federal government, and this is an issue I know a little less about, but the federal government does have an interest in reducing the costs of Medicaid for taxpayers. And as we know, a lot of the treatment, if we're repeatedly treating offenders in prisons and jails, that has a Medicare cost, or Medicaid cost, I'm sorry. So it's incumbent upon us to help try to drive down the costs. So with that, what the senator introduced was a bill called the Mental Health and Safe Communities Act. And we sort of tried to address each and every one of those boxes I just laid out on the federal roll. First, what we do is we reauthorize what's called the Mentally Ill Offenders Treatment and Crime Reduction Act. We reauthorize that at existing federal funding levels. So essentially what we would be doing is requiring more of the federal Department of Justice grant spending to go towards mental health treatment in the criminal justice system. So we reauthorize that program and expand it in a number of ways, allowing law enforcement agencies to do what we call crisis intervention teams, training law enforcement agencies to respond to mental health. We also add some authorizations for veterans treatment courts and for other specialized court programs, and for what we call forensic assertive community treatment initiatives, which which follow through with mentally ill offenders after they're released from jail and prison to make sure they continue getting their treatment. So that's one of the big pieces of the bill. The other thing we do is we also reauthorize the National Instant Criminal Background Check System in the bill. This is a provision that we have support from everyone from NRA to the National Alliance on Mental Illness on this provision. And what we do is give some clarity to the states as to what mental health records they need to upload so that they can comply with requirements that they upload records. And also provide incentives for the states rather than penalties to actually upload mental health records into the background check system. The other big piece of this bill is we would reauthorize what's called the mental health court, the federal mental health court grant program, and expand purposes for that. So that program has been expired and has not been funded for years. So what we would do is reauthorize that, allow state governments who want to implement best practices on mental health courts to ask the federal government for some funding to do that. And we would also expand that program to include what are called assisted outpatient treatment courts. And these are their intermediate steps so that families watching their loved one degrade can go to a civil court, get an outpatient treatment order instead of having to get their loved one committed. So it's an intermediate step you can take before justice system involvement or before commitment to actually get help earlier, before the situation becomes unmanageable. So that's a lay of the land on what the bill does, and I'd be happy to answer any questions y'all have. I'll note that the bill is endorsed by, we worked closely with the Council on State Governments Justice Center to draft this, but it's also endorsed by the NRA, the National Alliance on Mental Illness, Treatment Advocacy Center, National Association of Police Organizations, and the National Association of Social Workers. So pretty broad coalition as far as these things go in Washington, D.C. So thank you all very much for having me, and happy to answer your questions.
Thank you, Stephen. Okay, so we now reach the question and answer portion of our program. If you'd like to ask a question, please raise your hand. One of our helpful interns will arrive with a microphone. But first, I would like to take the moderator's prerogative here and ask a question. A thing that came up several times, both in the beginning and the end of the presentation that we heard, is the cost, the siloing. So I guess this is directed at both Kate and Steve, though everybody else feel free to weigh in as well. So Kate, you said that there are 18 state agencies that have some sort of function in the mental health system. You said that this touched 5 articles of the budget out of a 10 article plus a wish list. With this broad spectrum of, is there any estimate on the duplication of effort? I mean, has anyone ever put a financial estimate on how much this is costing the state?
Well, I can tell you that the HHSC's latest estimate of what we're spending across all of the articles is $3.6 billion. That is an underestimate because it only looks at 52 initiatives that are in one or more or that are in more than one state agency at a time. So it's actually going to be more than that. It's a very significant amount of money, and HHSC is actually getting ready to institute a task force to get a better grasp on exactly how much we're spending, particularly through contracts and things like that. but we don't have a full picture of exactly what it's costing the state.
How do we break down these silos?
Well, we need a lot better coordination and communication. I think the forensic director position is going to go a long way toward it. I think the sunset process, which is going to help integrate the state agencies and streamline some of the administrative issues and bureaucratic issues facing all of the agencies, is going to also go a long way. Sonia Gaines was hired over the interim last time to work on mental health coordination statewide. I think all of these things are tools we can use, but especially when you're looking at it from what's provided at the state level, what's provided at the local level, what's provided privately, what's provided federally. I think it's something that really needs to be implemented at a community level, where communities are taking a hard look at what's going on there and saying, here's what we have, here's what we don't have, here's where we're maybe duplicating things, here's where we're not doing a very good job, and really work as a community to address the issues, because it's really too complicated of an issue for the state government to come in and be like, here's your quick fix, or for the federal government to come in and be like, here's your quick fix.
Stephen, similar question. You granted the federal sphere is far different, especially it's as far as direct service provision. I mean, there is some, but definitely not at the level that you see in the states. Are you experiencing the same kind of siloing effect? And is there a CBO estimate or the like on the kind of redundancy that Kate just mentioned and that we're seeing here in Texas?
So, at the federal level, you have generally, I think, it's usually a less complex issue than at the state level, because what y'all have at the state level are the nexus between state. You have state governments, you have municipal governments, you have county governments, you have all sorts of different municipal corporations, and you all have to be sort of rowing in the same direction at the same time. Whereas in the federal government, we just don't have that. It's just federal agencies talking to federal agencies. For instance, in the criminal justice system, federally, it's really just HHS and the Department of Justice. So we have, I guess, less of an excuse to have problems. I think the latest Bureau of Justice Statistics estimate we have on mental illness in the federal system is that something like 40% of persons in federal prison have some sort of classifiable mental health problem. So we clearly have to do more in the federal system to break that cycle. But one thing I will note on the spending point is, so every year the federal government spends something like $2 billion on Department of Justice grant programs to state and local governments. And we can fight all day long about whether those are the appropriate levels or whatever. But one thing we do know for sure is that for the state and local governments, the issue of mental health in the criminal justice system is among the most time-consuming and largest costs they face. And the federal government every year, out of the $2 billion we spend in Department of Justice grants, only spend $9 million of that $2 billion on helping states to implement best practices on mental health in the criminal justice system. And the senator's point is, whatever you think about whatever the federal level total level should be, that I think we can all agree that more than like a fraction of a percent of Department of Justice grant funding should be used to address the most pressing problem, or one of the most pressing problems in state justice systems. And if we're serious about reducing crime and restoring communities, and if that's really the purpose of federal spending, then we need to think long and hard about prioritizing the mental health and criminal justice funding, because that's where we see striking outcomes.
Excellent, thank you. Do we have a question from the audience? Please.
Thank you. This question is for Mr. Townsend. Are there funds that go through the health system as opposed to the DOJ? And what is the enactment number on the mental health and communities, safe communities legislation?
So I got into federal and state jurisdiction earlier today, and now I'll get into committee jurisdiction. So Senator Cornyn's on the Senate Judiciary Committee. And our bill, to sort of respect our lane, our bill just focuses on Department of Justice side. So we don't get into the Medicaid, we don't get into the issue of mental health for persons who are not involved in the criminal justice system. Our hook here is the criminal justice system. The only extent to which we touch the non-criminal justice aspects of this is by defining the types of civil court orders which would essentially limit your Second Amendment rights. That's the only way in which we touch a non-justice system issue. And as far as amount of spending goes in the HHS, honestly, I'm not an HHS guy. I mean, I just don't know that much about that aspect of the mental health system.
Steve, if I could follow up, so isn't there a component of the senator's bill that is specific to assisted outpatient treatment? Right, and that's not connected to the criminal justice system at all.
Yes, but that comes in through, so we have that in a Department of Justice grant program. The Mental Health Court Grant Program is a Department of Justice program. We add AOT courts in as a purpose area in that. So the Judiciary Committee does have jurisdiction
Over the courts.
over the courts.
I see what you're saying.
So it's not that's.
Because I just want to make sure that people understand that assisted outpatient treatment is really about keeping people in the community versus
Absolutely.
the consequence of not participating in the program is jail, but it's hospitalization usually. But I just wanted to make
Yeah,
that
no, I mean, that's exactly right. AOT courts are technically not criminal courts. And the idea there is the biggest barrier we hear from people we talk to and practitioners is that, look, these families don't know what to do. The example the senator always uses is Adam Lanza's mother in Newtown, Connecticut. She had a son that she loved and cared about and thought she was doing right for, but she had to watch him degrade over a long period of years, degrade and just feel totally helpless because her only choice was get my son taken away, what she doesn't think is going to be good for him, or just let him continue to degrade. And our idea here with the AOT courts is here's a step for families and for communities to come in and try to get this person help, short of taking away their liberty.
Whomever.
This question is for Veronica. First of all, I want to send kudos to the foundation for putting a consumer on the panel, putting a face to this problem. Thank you for that. And I like the way that Catherine was talking about peer supports. Veronica, where in your journey did you find out about the opportunity of becoming a peer support?
All right, yeah. It was actually when I was in school and kind of, thinking about where I wanted to go. And I had a counselor kind of just let me know, why don't you volunteer some of your time at the state hospital? So I did, and I went in originally just volunteering with education and rehabilitation. And it was maybe 3 years, 4 years of just volunteering there that I finally heard the word, like peer support. It was just a word at that time, So once I found out about it, what it was, and I was like, I fit this, I can do that, So that's the point where I knew what peer support was. Thank you.
This is a big picture question, and I'm wondering how much revenue does the corrections system generate? It may seem like a silly question, but believe me, it has a lot of value to me.
I haven't looked at the revenue of what the criminal justice, in Texas particularly.
So,
I'll field that one. Most certainly not. You do have a modicum of prison industry through which work programs and such can actually produce a product that is remunerable. But I mean, many orders of magnitude far shy of actually being self-funding. And so I think that really illustrates some of the importance that we have both as a conservative foundation, as liberal foundations, have simply make sure that we are spending the money that needs to be spent, but only the money that needs to be spent. If there are alternatives that provide for public safety, that head the problem off at the pass, those are the alternatives that we should be looking into, and making sure that we are not actually creating more costs for ourselves down the road. And then we have one up here.
Hi, so my question has to do with medication and guardianship. I have a son who has chronic mental illness. He is currently at Vernon. And it took me 7 years to get guardianship of him. And I believe if I'd had guardianship earlier on, that I would have been able to get him some help that he needed. He went in and out of the mental health system, insurance that would only keep him 15 days in a hospital, in and out of the Austin State Hospital, barely getting him competent, being out on the street as being homeless. And it finally took him making a serious threat, even though he had threatened me a month ago, calling the police and saying he had a gun to my head, which he didn't. My family being surrounded by police, always facing a fear when I have 4 children of what he might do. When he finally threatened a judge, they went in, gun blazing, filed a felony charge against him, and sent him off to prison. It took me a year and thousands of dollars to be able to get him declared not guilty by being insane, and now he's at Vernon. It's not right. I should have been able, now that I have guardianship, I have some say in what medication he's on, where he goes to see a doctor. He's not out yet, but those are the types of things that I have. I feel that as a parent, that I should have been able to have some guidance over him, some knowledge of being able to talk to doctors and be able to get him the help. And is there some type of law? I understand that, we can't just lock them away, but like you say, we're locking them away in jails, and he'd been in and out of jails 3 or 4 times. Isn't there some way that we can pass a law that allows a parent or some stable person to get them a guardianship at a much earlier age, where they actually have access to his doctors, his health, his medicine, and really get him the help that he needs before it gets to this stage?
I appreciate you sharing your story with us, that you've endured a lot and you've been a strong advocate for your son, it sounds like. I think that part of what the assisted outpatient treatment is a component that could really have benefited from your son and your family. I ride the fence of assisted outpatient treatment because I want to make sure people who have that lived experience of mental illness have a voice in their treatment. I also think it's really important that there's a robust mental health system that's available and can provide the services before you force somebody into treatment. But I think to answer your question specifically is that, I don't oppose assisted outpatient treatment in the sense that there is an opportunity to kind of have some a little bit of leverage for families to be able to provide, ensure that their children are getting services, or for that individual. There have been, this past legislative session, there was a coalition of folks that worked on guardianship-related issues. There was several bills that were passed. I don't have those expertise, but afterwards, I'll make sure I give you my card, and I'll get that information to you so that information is available. But I think your story is very similar to some of the other stories that really spurred some of the guardianship-related issues and the ways in which we're able to access services and help families. Thank you so much for sharing, but I'll make sure to give you my card so I can get that information to you.
I'll just say your story and stories like yours are something we have heard dozens and dozens and dozens. I mean, just same exact thing. And it's really one of the things that brought the senator to the table on this issue is I think families feeling helpless in the system is a problem. And it's particularly a problem when the system yields bad results. And what we see now is a system in which families and the people who should be involved are not as involved as they should be, and the system is yielding poor results. And I think that starts to make the case for change. Just one thing you hit on in there in particular is what we see in a lot of state laws are a requirement that a person be in imminent danger before they can be committed and get help. And the problem is the imminent showing in a court context is almost impossible to make. One of the things we do in the Senator's bill now, I'm not going to tell you that it fixes all the problem, but one of the things we do is we change the federal definition from imminent dangerousness to danger to self or others. So you don't have to make the imminent showing anymore. And what we say is that any state statute which says just general dangerousness, there's a finding of general dangerousness on mental health grounds, that's a qualifying mental health record. So if you're a state that changes your statute to not be imminence anymore, and your commitment laws now reflect that, then the records that resulting from that commitment process could be uploaded into the federal background check system. It would count as a qualifying mental health record. So I think the senator's hope is, knowing we can't go in and amend state mental health laws, our hope is that the federal government can lead by example here and say, look, this is a problem that is recurring, the imminence showing that we have families have to go and lie. They have to go and lie to law enforcement and say, oh yeah, he threatened to kill me, just so they can get their loved one help. And it's a bad result. And
Even if you say that, they'll come to your door, and if your son or that person is not there, they'll say, well, you're not in danger right now, and he's not in danger.
no, and you know, we hear from a number of judges who say, my hands are just tied on this. Like, this person is clearly degrading. He's clearly going to become a danger. He's going to have a relapse, but we can't step in because there's no overt act no overt violent act, and it's a problem. What our bill would do is change the federal definition and say that the federal definition doesn't have to encompass imminence anymore. That general dangerousness is enough.
And I think the thing to add on to that as well is that if it requires a point of decompensation to the point where an individual has to have law enforcement called on them, that escalates the dangerousness of that situation, not only for those who were imminently in danger prior to, but for the individual suffering as well.
I think it's also just worth noting here, since we're talking about these violent acts, that generally people with mental illness are not violent. They're only responsible, mental illness as a risk factor for violence it's only 4% of violent acts that can be attributed to mental illness or a symptom of mental illness. So if you eliminated mental illness as a risk factor for violence, violent acts generally would only decrease by 4%. There's a Swanson study from, I don't know, like this year or last year that showed that. And also in terms of criminality, mental illness it's a very small part of what causes criminal behavior. There's a Peterson study that came out last year that showed that mental illness only accounts directly for 7.5% of crimes, and mental illness or a symptom of it might account for as many as about 18%. So,
And that's inclusive of public order crimes.
that's not certainly to diminish any of the experiences that people have had with their own family members or what's been going on, because those are serious issues and they're important issues. But I just thought it was worth noting at this point that it's really only a small piece of the puzzle.
And I think one thing to note there, to just sort of add on to your point, though, is while that is mental illness is a very small subset of total crime, I think it's worth noting that is a subset of crime which we know how to address.
Mm-hmm.
Like in so many contexts, it's difficult to figure out what works on a particular subset of it. Like, what do you do to make sex offenders better? You know, is there anything you can do to make sex offenders better? No one knows. But with people who commit crimes because they're mentally ill, that is a subset of offenders which we know the answer to why they committed crimes. It's because they're mentally ill. And if we could figure out how to treat the mental illness, that is a subset of crime that we could drive down enormously. So I think that's the...
Yeah. I think a lot of the crimes, though, that we're, in those percentages that were shared, you know, are for nonviolent crimes. And a lot of individuals that are in the county jail system are for nonviolent crimes, trespassing, public lewdness, things like that. Those are nonviolent crimes. They just kind of get stacked onto each other. One thing, if I could go back real quick, is that there are a lot. I've read through the bill, and there's a lot of great things about it. But there's a couple things that are concerning. Just I think adding a look back period for looking at somebody's incarceration or hospitalization history during that assisted outpatient treatment would be a benefit for that individual, to make sure that, you know, you just have one incident versus a history of incidences before your rights are limited.
Excuse me, I want to correct my statement. Less than 15% of sex offenders ever offend again.
I'm not here to talk about sex offenders today. Like, I was just throwing that out there as an issue that's debatable, obviously. Yeah.
Hi, first of all, thank you all for your presentations this afternoon. Understanding we just finished a legislative session recently, and we're about a year and a half out, I guess I'd ask this two ways. What do you see on the horizon for the next legislative session in terms of any action that would be significant to address the problems you've all identified today? Or what do you think is the single greatest legislative action needed to address the problem?
We can start with Kate and work our way down.
That's a big question. There are a number of things that need to be done, so it's a difficult question to address. But I really do believe that the source of a lot of the problems is that the state government really is not doing its job in this area. And what I see as the state government's job in this area is to provide leadership, oversight, and ensure transparency. So I think legislatively what I'd like to see is the state government direct DSHS to shore up those roles and give communities more flexibility to address the problems that are unique and different in each Texas community. Because when you look across the board, the problems in Houston are not the problems in Austin, are not the problems in Tyler, are not the problems in Amarillo. You know, we've got a very diverse, large state with diverse and different needs. And so if we're going to really get down to the issue and really make a meaningful difference, I think that has to happen where where the rubber meets the road. All healthcare is provided at the local level. All criminal justice, for the most part, at least with law enforcement, is administered locally. So the state government really has a role in, making sure that we're getting the outcomes we want, funding in a way that's going to align incentives correctly, maybe providing options for best practices, but if you're really going to make meaningful difference here, that has to happen at the local community level, and those local communities have to have the flexibility to do what works for them.
Catherine?
I really know my audience here. I think really holistically is expanding Medicaid to adults that fall in the coverage gap. I think that's really important because what we've seen in numerous studies throughout the United States is really looking at is that people that have healthcare coverage are able to have the access to healthcare services, and we're talking about prevention, early intervention, access to treatment before individuals are involved in the criminal justice system, and that makes a difference, so that we're treating and people have the opportunity for treatment before they're in the criminal justice system. I think holistically, that is the way in which we can look at moving forward for this next legislative session. We've kind of missed a couple opportunities this past couple of sessions, but holistically, I think that's where we really can start, is ensuring that people have access to services early on.
Can I interject?
That's good.
Well, I'm going to make everyone who just clapped unhappy.
And that's why we're here together.
Yes. Because I disagree. I disagree with Catherine. I do believe that access to care is important. Do not get me wrong on that. Access to care is a very important piece of the puzzle. Prevention is a very important piece of the puzzle. I do not believe that the best way to do that is through Medicaid expansion. What we're seeing in states that have expanded Medicaid is that it's much more expensive than anyone expected it to be. And in a state like Texas, where we have so many people who do fall into the coverage gap and who are going to cost so much more money than we probably could ever guess, we might very well bankrupt the state trying to do that. We really need to take, the foundation really believes that there is enough money in the system to address the issue. And it's more a matter of spending it well and spending it in a way that works. I think a lot of money in Texas is wasted on bureaucracy, on administration, rather than on treatment and prevention. And I think if we made a wiser use of our resources and had the flexibility to implement programs that work at the local level, we would see a much more meaningful and cost-effective way of expanding access to care and getting preventative treatment out there.
Well, thank you, Felix and Oscar. I love that witty rejoinder. Now, Veronica, from your perspective, as an actual practitioner, what could be, rephrasing that question a little bit, what could be done to make your job easier, to help the outcomes or help other people reach the outcomes you were able to experience?
Well, I'm going to just say this on a personal level. I work with a lot of people who have criminal charges pending, who've had a lot of trauma in their life. And I think really having the clinical staff, like really buying into that, it is part of that, that whole team effort that's really needed to help someone get, to be able to move forward, because sometimes I find that seems to be a big barrier. So addressing their trauma is super important, and it doesn't get done enough.
So Stephen, I think it would be a bit of a disservice if we didn't include you on this, but you've already answered it several times over with the item of legislation that's before us. Let me repackage that question in a way, I guess more broad, that rather than mental health, what about some of the federal reforms on more of the specifically criminal justice issues?
So Senator Cornyn has another bill known as the Corrections Oversight, Recidivism Reduction, and Eliminating Costs for Taxpayers in Our National System Act, or the Corrections Act.
That was a masterful acronym.
For short, that was a doozy to come up with. We introduced that bill. So last Congress, that bill actually passed the Senate Judiciary Committee by a vote of 17-2. We are working now. So what the bill does is, at least in the federal system, it would require every prisoner to participate in some form of recidivism reduction programming or productive activity. The idea there being every day that we're spending money for a federal prisoner to be incarcerated and not working to make sure they don't come back, we're just wasting money. So what our bill would do is essentially require every person who comes into federal prison would have to be assessed for their recidivism level, what their predicted recidivism level is, and what sorts of programming would work to drive that down. And then we would, through a number of ways, increase the amount of programming in federal prisons so that each and every federal prisoner is getting some sort of programming that is going to drive down their recidivism level. So that's Senator's bill.
I'm sorry, can I just
Absolutely.
say something about that recidivism? I think people will continually go back to jail if some serious barriers are not knocked down for them. Like, I mean, there's no way that I could have gotten to where I'm at right now had it not been for some very special people, like really taking a notice and listening to my story and giving me like a real chance, and I find that doesn't happen often enough. I mean, because that you can do all of that stuff, but people will continually go back.
I agree. I think one of the top barriers we see for persons leaving incarceration is unemployability. And we know that what's the best recidivism reduction program there is? A job. We know that. I mean, the data bears that out. So part of what our bill does is expand the federal prison industries program, which Derek had hit on earlier. But it's a self-sustaining program. It just pays for itself through having federal prisoners build things for the federal government. But also our bill would expand partnerships between the private sector and the prisons so that, for instance, the National Association of Home Builders have a huge labor shortage issue. They're actually going into prisons in some places, training people to do construction so that when they come out of prison, they've got a job in construction. In North Carolina, for instance, Meineke Mufflers came in to a couple of prisons there, trained the prisoners to get their, I guess their ASE certification or whatever it is, and come out with a job at Meineke Mufflers. And the idea there is, you're right. If we don't do the follow through, a famous criminologist, his name's Ed Latessa, used to, in mocking, programming that doesn't work, used to always say, if you teach a prisoner how to bowl, what you're gonna have is a criminal who knows how to bowl. So the idea being, we've got to figure out what works. It has to be effective programming, and the only way for it to be effective is to follow through and look at the particular risk drivers of particular prisoners, and actually make sure we're monitoring after they leave prison and are on reentry.
As a graduate student of Dr. Latessa's, I'd say that was an on-point impression there. Okay, we have time for one more question. Let's go right here. Right in front.
My name is Colleen Horton. I'm with the Hogg Foundation for Mental Health, and I really appreciate all the comments today. I do want to express one caution, and that is that we don't turn mental health into a crime. We talk a lot about assistive outpatient treatment, also known as forced treatment. We talk about this registry. If you have a history of mental illness, you're going to go on a registry. There are some very fine lines and not very many black and white lines in all this. And I haven't really heard much about protecting these individuals, protecting their right not to go on a registry, protecting their right to choose what kind of treatment they receive. And I think if we don't make that part of the dialogue, we're really going to go too far the other way. A friend of mine who's a peer specialist at ASH recently reminded us that, and this isn't Senator Cornyn's bill, it's Tim Murphy's bill. It's called, I just lost it.
Ma'am,
Helping
I'm going to have to
Helping
insist on a
families.
question
Helping
coming.
families in mental health crisis. It doesn't even mention the individual. So my question to you all is, how are we going to move forward on providing better services and more protection while at the same time protecting the individual's rights?
So I would say, and I guess maybe this didn't come out in my remarks, but we worked with the National Alliance on Mental Illness and the Treatment Advocacy Center day in and day out on this. And one of the main goals of our bill is actually exactly what you're talking about, which is reducing the criminalization of mental illness and providing protections for individuals. a majority of this bill is focused on ways to get help for the mentally ill so that they don't commit crimes, and diverting them from jails and prisons to other appropriate forms of custody. That's a huge part of the bill and what we're trying to do. One of the things our bill does in the context of the background check system and the exclusionary records is we say and clarify that you can never lose your Second Amendment rights on mental illness grounds unless you have had notice and an opportunity to have a hearing in front of an impartial adjudicator, at which time you can bring an attorney. Like, so often now, what we see are cases where governments are excluding people from having their Second Amendment rights based on a determination that they need a fiduciary or someone to help them balance their checkbook. So what we focus on in our bill is not, so too often what people want to focus on is loss of rights based on treatment for mental illness. We shift the focus from treatment to whether or not this person is dangerous. We think that should be the question shouldn't be, is this person mentally ill and receiving treatment? The question should be, is this person actually dangerous? And our bill moves us away from this system of sort of putting a black mark on your record just because you're getting treatment, and focuses on a dangerousness analysis and prevention and diversion instead of expensive and ineffective incarceration.
I'm afraid that's actually all the time we have. Everybody, ladies and gentlemen, please join me in thanking our panelists today. That was a very productive discussion, and with I think some of the background provided by some of the questions and answers, I really think we helped kind of foster a better understanding of some of the issues that are facing mental health in the criminal justice system today. Before you leave, I'd just like to announce 3 upcoming events that we have. On Monday, there will be an event down in Houston, a traveling primer, an overview of the 84th Legislature. Switch Off Washington will be hosted here on the 23rd, and that'll be a review of the EPA's Clean Power Plan. And then finally, the debate over Texas state-supported living centers, how to reform an outdated system, will be October 6th here. And this will look at the ineffective systems of care that we have kind of built up for those with intellectual and developmental disabilities. Ladies and gentlemen, thank you for attending today.